Tianfu. I love this point. The third point to be known as a Tianfu. Tian means heaven. Heaven point is there on your shoulder, just distal to the shoulder. 3 chun below. 3 chun distal to the anterior axillary crease on the lateral border of the biceps muscles. Lateral border of the biceps muscles. This point is amazing point to treat for the numerous diseases, but especially this point is Tianfu and then Siapai. This Tantian, hand Tantian to be known as a middle Tantian of the lungs. Middle Tantian means area of the lungs. That means is the emergency, that to be known as a oxygen point. Emergency oxygen point. That oxygen point to be known as a how the deriphyllin injection, how the bronchodilator is functioning in the lungs after using the injections, intramuscular or intravenous injection to during the attack of the asthma. That time you can use the point to be known as a Yun Tianfu and then is the Siapai. That means there are the 2 points are really good point to treat for the acute asthmatic conditions. When there is a problem like a respiratory illness, asthma is there, suddenly shortness of breath or breathlessness, that time you wanted to control and stop that. You can use the point to be known as a Tianfu and a Siapai. 2 points are really great point to treat for all the pulmonary related disorders. Not only that, major another advantage to be known as a goiter related problem. Thyrotoxicosis. When the enlargement of the thyroid gland, enlargement of the thyroid gland, non-obstructive thyroid gland to the trachea can be treatable by activating to the Tianfu point. Once keep activating this point, I wanted to add up the another point to be known as a Pinau. Pinau, that means large intestine 14. The 14th point of the large intestine, and also this is Tianfu. Together is very good protocol to treat for the goiter. At the same time, patient feel dizziness. When patient feel the dizziness and fatigueness and then giddiness, all are treatable by using the Tianfu as well. By treating the Tianfu. Giddiness, and also there is a thyroid gland enlargement and acute attack of the asthma. How the points are significant by using the LU1, same significantly can be treatable by activating this particular point as well. So these are the 2 points are great point to treat for the all the lungs related disorders, goiter related conditions, and also thyroid related disorders, and also vertigo. So hopefully you understand this is emergency oxygen point. Perhaps you may ask you, write the emergency oxygen point in our body. Which is the emergency oxygen point? You can write Tianfu or you can write the Siapai, but you will get the full marks. But you all try. When the patient is complaining, I do have some kind of the problem. So you ask them to give the pressure on that region. You just do it yourself for a few minutes. Later you can do that. Ask them to do the pressure on that region, where exactly on the anterior part of the deltoid muscle this point is located. Certainly you will get lot of changes. But make sure that, because on the LU1 there is a subclavian artery is there, but on the LU2 again it is the axillary artery is there. On the LU4 and then LU3, make sure that branchial artery, that means the biceps artery, so shouldn't get disturbed. But of course that also sometimes will get reflected. But if you are giving us a mild pressure, you are activating as a half zone, that will not cause much harmful to the body.